Hi, welcome to It Takes Guts. I'm your host, Stacy. I have been a gastroenterology nurse practitioner for the past 6 years. Prior to that, I was a nurse in the endoscopy department for 15 years. So, as you can guess, I love gastroenterology, which is why I'm making these videos, because I want to help you be educated so you can make informed decisions about your health. So, I'm glad you joined me today. We are going to be discussing colon cancer screening. That might strike fear into some of you. It should not. If you are around the age of 45, because I was that last year. So if you're around the age of 45, you're probably starting to hear the rumblings from your primary provider saying, hey, time to start your colonoscopy or get a colon cancer screening of some type. I'm here to tell you there's nothing to worry about. That's absolutely what you should be doing. This is for health maintenance. Just like we get our mammograms or guys get their prostate exams, colon cancer screenings, it's really important. Colon cancer is the third leading cause of cancer-related deaths in America, if you don't include skin cancers. This is preventable for most people. The screenings are really straightforward. The most common one we hear about is a colonoscopy, and that was what makes people nervous. No need to fear. I just had my colonoscopy this past year. It was so easy. Here, I've been setting it up for people. I've been assisting with these, and then I finally had my first, and it was really a breeze. Everybody complains about it. Your neighbors, oh, it was terrible. It's not. I don't like to miss a meal or a snack, ever. I'm a snacker. So I thought the clear liquid diet the day before was going to be hard. Not hard. Vegetable broth tastes really good. White grape juice is like dessert in a cup. You can have a bunch of different herbal teas, Gatorade, you can have popsicles, Jello. You can have a whole bunch of stuff that's considered a clear liquid. It's great. Vodka and beer should not be added on that list of clear liquids, though. Well, you got to be smart about it. You do have to take a laxative to clean you out. The laxative that we use, it's really not bad. We have you take a little bottle of magnesium citrate. That's like the sweetest, tartest lemonade in the world. And then we have you mix a powder laxative like Miralax with Gatorade, whatever flavor you want that's not red or purple. And there are so many flavors out there. If you don't like Gatorade, you can put it in something else that's clear. It doesn't matter. It makes you go to the bathroom. You will spend a lot of quality time in the bathroom that night getting ready for your colonoscopy. It's okay. I put a movie on the iPad and I watched a movie that night. Not a problem. The colonoscopy itself is really easy. The reason we do this is because with a colonoscopy, you're asleep, great nap, and your doctor's able to insert a very tiny little scope with a light on the end that has a camera. They can look throughout your entire large intestine. These are where we are looking for colon cancer. If there is a growth or a polyp, most of the time we can take it off right then. If it's potentially precancerous, it's gone, it's off. It can't turn into a colon cancer. That's the colon cancer prevention part of this. It's great. If we were to find something that was too large for us to take off or that's advanced, we get the ball rolling. We biopsy it. We get you in for a CAT scan. We get you in to see a surgeon. This is what we do. So that's really why the colonoscopy is recommended for colon cancer screening. We're looking for polyps or growths. We take them out. Then hopefully you don't have anything else growing again. Sometimes you have to come back a couple years later. If you don't have any polyps, usually you get 10 years before you have to come back. So it's really not a bad idea. You feel pretty good when you're done, actually. The sedative we use, it's the best nap in the world. And then you wake up a little groggy for a few minutes. I made my husband take me out for breakfast and I ate everything on that plate and felt great. So colonoscopies, definitely a great colon cancer screening. Some people are really, really afraid of the thought of a colonoscopy, or you can't take that day off, or you can't get a ride because we sedate you. You definitely have to have a ride. You're not allowed to drive yourself. There may be a few different reasons why colonoscopies are not something for you. There are some other colon cancer screening available out there. One of them is a stool test. One of them is one that can be done through your doctor's office called a FIT test. It's looking for blood, a certain amount of blood in the stool. And so you put a little stool sample on the paper that they give you and take it back to your doctor. Don't put it on just any piece of paper. It needs to be specifically on what they give you, and then turn it back in and they test for blood. There's another one that most people have seen a commercial for, Cologuard, where they mail you this kit to your house. You follow the directions, submit a stool sample, and mail it back. And then the results get mailed to your provider who ordered it. That one is a little different than the FIT test. It's not just looking for blood. It is also looking for DNA that can be sloughed off on colon cancers or very advanced precancerous polyps or growths. The results are either positive or negative. So if it's negative, didn't detect blood or DNA. If it's positive, it detected something, but it doesn't tell us what. If that comes back positive or your FIT test came back positive saying, hey, it looks like there's some blood in the stool, you need to get the colonoscopy. There's always a chance there's a false positive, especially with the Cologuard. It's a low risk, but at any rate, do the colonoscopy so we can find out what's going on. The other screening that we really don't use very often, but is still an option, is called a CT colonography or a virtual colonoscopy. It's actually a CAT scan. And you still have to do the laxative to clean out, but then they have you drink this other stuff so it can kind of tag any fecal material or leftovers that are still in there. So that way, if it says, oh, there's something there, it looks like a growth. Oh, no, that was a little poo left over. They can tell. That one is okay for somebody who maybe not be able to undergo sedation for a colonoscopy or something. It can detect usually 4 millimeters or larger for a growth. Again, if it shows something, you're still kind of stuck getting the colonoscopy. So that's not one we usually go to as a routine, but it's still an option. Some people ask, is there a blood test? There are no blood tests out there that are really good at detecting for colon cancer. That's just off the table. So really, gold standard is still the colonoscopy. And if for some reason you're like, I just can't do it, I don't, for whatever reason, get the stool samples, get the testing done. If you're 45 and your doctor hasn't, or your nurse practitioner hasn't started mentioning, hey, it's about time for a colonoscopy or a colon cancer screening, mention it. They would be duly impressed that you even knew. But it's really important. This is part of taking good care of your health. This is so important. It's so great. It's so easy. If you're concerned about something, if you're like, I don't know, I have worries about this or have questions, please contact your primary care provider. Contact your local enterologist. Anybody would be more than happy at these offices to talk with you and help you. So that is pretty much wrapping up our little segment on colon cancer screening. Please leave a comment. If there's a particular topic that you would like to hear about or you want me to discuss, it needs to be gastroenterology related, please. Let me know. This is what I'm here for. These videos are really to help you be educated so you can be informed and know that you're not alone. Thanks again for joining me. Bye.